Hello, my name is Dr. Lester Hartman from Westwood Mansfield Pediatrics. We are going to talk today about nosebleeds, something called epitaxis in medical terms. This is strictly for patients of Westwood Mansfield Pediatrics. Our advice is for our patients specifically. Follow your physician's advice if it's different than ours. Today I want to talk about nosebleeds, which is a very common thing that sometimes concerns parents. First of all, if a nosebleed doesn't last more than 10 to 15 minutes, it's rarely of anything of serious nature. Number two, note whether it's one-sided or two-sided. If nosebleeds are one-sided, it's very rarely of any significance. Even two-sided nosebleeds are not indications of serious diseases. Sometimes parents worry about leukemias or cancers. But something that only goes 10 to up to 15 minutes at most is very rarely a problem, or a blood coagulation problem as well. So, oftentimes nosebleeds will happen in particular seasons, like the winter when it's really dry, or the fall and spring when people's allergies flare up. For example, there is a septum between your nose here, there's a wall between the two nostrils, and on that wall are veins. They're like varicose veins on people's legs. When they get exposed to dry air, or as commonly done in younger children, picking their nose, that will make the vessels break and bleed. So as a result, that's what sometimes we see happen. Oftentimes with nosebleeds, just putting Vaseline in the nose if they're recurrent, putting Vaseline in the nose just about that far up with a Q-tip twice a day will help to subside the problem with nosebleeds. Occasionally, some people will need medicine for nasal allergies because they bleed. And in fact, sometimes it's the other way around. The nasal steroid will create nosebleeds in kids. Nosebleeds can be very annoying if they're really frequent and disruptive. But usually start with the Vaseline and try that first. If the nosebleed goes beyond 15 minutes, then we would explore more of the possibilities of a coagulation problem. There's something called von Willebrand's disease, very rare, but possible. Usually somebody's bleeding on both nostrils, and it's very important before coming in to note whether your kid's bleeding from one nostril or both nostrils. And that helps us get a good history of what's going on. And whether the blood is spurting or if it's bright blood or dark blood as well is something important to let us know. Oftentimes, again, one of the common things is nose picking. So keeping your kid's nails clipped, put that Vaseline in the nose, will help reduce the problems with nosebleeds. Whenever you have a nosebleed, have your child tilt their head back, squeeze the nose like this, and hold it there. Some people will put ice on the nose a little bit while they're doing it. That's fine. But usually that's about all you need to do. And drinking hot liquids just afterwards is not necessarily a good thing to do as well. This is Dr. Lester Hartman talking today about nosebleeds. I hope this is helpful, and have a good day.